Hello, everyone. I'm Jonathan Calixto, and today is Tuesday, April 15th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Now, recently, the U.S. has seen a significant rise in measles cases, with numbers approaching 400 in some regions. This uptick has raised concerns among public health officials as measles is a highly contagious virus that can lead to serious health implications. That increase is largely attributed to declining vaccination rates and outbreaks in communities with lower immunity levels. Now, Dr. Brenda Anosike, the Director of Diagnostic Stewardship at the Children's Hospital at Montefiore, joins us now to share some advice on how you can protect yourself and your family. Hello, Doctor. Welcome.
Thank you so much. Thank you.
Yeah,
Good
well,
morning.
good morning. I mean, it's an unfortunate, obviously, conversation that we have to have, but a very important one for our community. For people who may not be aware, can you give us a little bit of information about this viral disease?
Absolutely. Just as you said, measles is in fact a viral infection, and it can actually look like some of the more common cold symptoms. And it's a highly contagious virus that can often present initially with really high grade fevers as high as 103, 104 Fahrenheit or 40 degrees Celsius. And it can also present with coughing and headache, but very classically can have redness of the eyes, and certainly you will have a distinctive looking rash that can start on the face near the hairline or even behind the ears and progress throughout the rest of the body. And this virus, as you stated, is really quite contagious, so much so to the point where, in fact, if one individual is infected and is around other individuals who are unvaccinated or partially vaccinated, about 90% of them will actually get infected as well too. So this is a virus really that has far reach and really has been shown to have significant complications in children, including pneumonia and swelling of the brain and other complications as well.
Wow. Now, of course, when you talk about that far reach, we are now seeing those numbers increase here throughout the U.S. Can you explain why we are seeing this kind of make headlines and increasing in our own country?
Absolutely. So, the rise in measles is largely due to the declining vaccination coverage in certain communities. Measles is, as we said, quite contagious. So, even in small pockets where there are unvaccinated individuals who may have had traveled to a specific endemic area where there is more measles in that specific area, or if they traveled across outside of the United States, and what happens is when they get infected, it can certainly lead to other individuals getting infected and causing these outbreaks. And so that's what we're seeing in Texas as well too.
Yeah, and we will definitely get into those numbers, even some of the numbers here in our very own state. With that, you talk about how it can affect children, adults, and some of the symptoms that we see rash, fever. Why is it so important to be informed and to talk about these risks, especially when it comes to our children?
Absolutely. So here's the thing. The thing with measles is that measles, unlike the common cold, can have those complications that we talked about before. And unfortunately, those complications can lead to significant morbidity and potentially death. And particularly in children who are so much more susceptible because their immune system is a little bit different from adults, and particularly the most elderly individuals as well too, as well as the immunocompromised. So these are folks who can't get the vaccination for one reason or another, or they have high risk of having complications. And so this becomes a huge public health concern because one individual who's infected can really potentially put at risk other people as well.
Yeah, and you put that emphasis right there on the vaccine. In many communities, there is a vaccine hesitancy as well. What impact does that have when we are seeing these cases continue to rise?
Yeah, I think that vaccine hesitancy is a very real phenomenon. It's not new. This has been going on for many, many, many years. And where that really the issue lies with the vaccine hesitancy is there's concerns that parents legitimately have about vaccines. And many of those concerns are things that any healthcare provider is apt to answering the questions to allay some of those concerns. The unfortunate thing, the fallback with that is that with some of these vaccines that have been known to be quite safe and very effective, remember with measles, measles was eliminated in the United States in 2000. And so with vaccine hesitancy, we're seeing a drop in the vaccination rates. And what's happening now is we're seeing that resurgence of measles. So in 2019, we saw a ton of measles. And now we're seeing again measles at record breaking numbers that are even surpassing what we saw last year.
Yeah. When you mentioned these record breaking numbers, I mean, here in New York, there were 4 cases, 3 in New York City and 1 in Suffolk County. Are there any other regions that we are seeing also a very high number of cases?
As of right now, I will tell you that is actually what's been reported by the Department of Health in New York. And so it's entirely possible that there may be cases of measles that have not been reported. Obviously, we're doing our due diligence. Providers are doing their due diligence. And the Department of Health is doing their due diligence to make sure that we're keeping track of the cases that we see. The unfortunate thing about measles in a lot of ways is that it can look like a lot of other diseases. So sometimes folks may not be aware, so it requires a hyper level of vigilance. So it may be that what's reported, those 4 cases that we have, are in fact what it has been actually documented. As far as whether other cases are out there, they're probably out there. We just haven't heard of them yet.
Now, of course, when you talk about even just those numbers obviously rising, some of us still identifying those numbers throughout the US. A big concern is obviously our children, as we mentioned earlier. Parents sometimes are concerned about vaccine safety. What would you tell them about why the MMR vaccine is safe and why they should look at that option?
I think that the first thing that is important is for us as providers, healthcare providers, to acknowledge those concerns. And not to be dismissive of parents who really want to do the best for their children. We all want the same thing. I think in terms of the vaccination safety, these are vaccinations. The measles vaccine actually came out in 1963, has been extremely well studied, and it's been deemed to be safe and in fact effective. So if you get 2 full doses, you have protection up to 97%. You're essentially protected. So we see that the concerns are there, but we really have to make sure as providers that we're having the conversation about what really is the truth about the vaccination.
Now, of course, in your line of work, doctor, for many years, when parents are looking to have these conversations with their doctors, with the children's doctors, can it be started at any point? Should they kind of look to just a primary doctor? Can they walk into a center? What is kind of that first line of how, them finding this help and resources?
Yeah. Well, I think the first thing that is most important is really reaching out to a trusted healthcare provider. We as pediatricians or any other medical health provider can absolutely be a source of information that is true for you and trusted, hopefully, where you've developed that rapport with your healthcare provider. But certainly, you may find that there's information that is also on trusted websites. For example, the CDC, as well as the American Academy of Pediatrics, where there's a wealth of information about measles and how to go about preventing measles and the appropriate course of action if there's a concern. So these are really resources that can be used. Now, there are a lot of resources on social media. The only problem with the social media is that it's unverifiable. So in which cases, if there is a question and you're seeing that source, you can certainly bring that to your healthcare provider and have a dialogue with your provider in terms of that information.
Awesome. Thank you so much for that information and just insight, of course, into how it affects and impacts our children and how we can look at protecting them. With that, there is this term that we are seeing around in the headlines in the news called herd immunity. What does that mean and why does that matter for our general population as well?
Oh, thank you. That's an important concept, a herd immunity. So herd immunity basically means that the level of protection that the vaccine confers when a certain threshold is met, so that it actually protects folks from getting the infection. So herd immunity is the community. And what we're really looking for is that if you are actually 95% or more, so that's that target that we're looking for. So those who are vaccinated, 95% is where you will actually have protection from actually individuals from getting the infection. Once that number drops, because of how contagious and how effective this virus moves and transmits from person to person, just by airborne, this 95% is essential to maintain in terms of the level of protection in that community. Once it drops, then you'll see areas where you'll see outbreaks as we're seeing in New York and other states alike too.
Yeah, now for, of course, viewers watching, when they're looking at maybe their local resources, what can health departments, schools be doing to kind of continue raising more awareness about what is happening and provide actual solutions, resources at that?
Absolutely. I think it's most important that folks take the time to really read and read trusted resources that we talked about, but also really talking with your healthcare providers as well too. Everybody is a little bit nervous about this, and nobody wants poor outcomes for their child. And certainly, it's important to make sure that you have adequate resources at your disposal. So the first place I would often say is your healthcare provider, but certainly schools also may have some information as well. But importantly, the Department of Health also issues advisories as well too, where you can actually learn more about measles and how to protect yourself. But beyond things, the other measures, the number one thing is really the vaccination. The vaccination is preventative, 97% effective. I can't reemphasize that enough. But secondly, also making sure that you wash your hands and ensure that you're doing it often. And because this virus is extremely, extremely contagious, one coughing or sneezing, even on surfaces, the virus can last for 2 hours, even after the person has left the room. So, washing your hand as you come into contact and ensuring that you're not really touching your eyes, your nose, your mouth, where the virus can gain entry is also another form of protection.
Now, I know, of course, personally myself, and I'm sure other people in general, like when we see these cases rise, we also wonder what other diseases can start to grow, what can be an outbreak eventually that we see on the news. What do you say is also a potential risk in cases rising if vaccination is not met?
Absolutely. So with that vaccine, the MMR is actually measles, mumps, and rubella. And these are all viruses as well too. Mumps can cause an infection of the glands of the cheek as well as the testicles as well too, and really can be quite severe for some young children. And then rubella can cause congenital defects in the unborn child. So you can see numbers start to rise with that as well. We're also seeing rises in polio because it's also affecting other childhood vaccinations in terms of the vaccine hesitancy. So polio is also something that we saw that was a little bit of a concern here in New York in 2022, and we are concerned that that is going to continue to persist as well.
Yeah. With that, I mean, thank you so much, Dr. Anosike, for just enlightening us with what is happening here, obviously, but what we can also do to protect ourselves and for our community to protect themselves. So thank you so much.
Absolutely, it's my pleasure.
Yeah. Now, for our viewers to keep up with to keep up to date with the latest news from the Children's Hospital at Montefiore, please visit their website at cham.org. Don't go away. We'll be back with more Open after this.